I need to know how to tell when contractions are real.
They keep coming and don't stop until the baby arrives.
That can take hours.
If the contractions are fake, the practice type, you'll feel one ripple now and nothing for a few hours. If the contractions are real, you'll feel one now and another in a few minutes, and they'll follow a pattern that gets closer together.
I haven't had that yet. And I don't know if I'm ready for the pain.
Practice contractions will cause pressure but won't hurt. Real contractions will cause some discomfort or maybe pain, but they will grow in severity and pain as the body tries to squeeze that big baby head through a small passage.
Half the pain is getting the baby through those turns through and around the pubic bone.
If you are in real labor, your cervix will be dilated. That doesn't happen with practice contractions.
It isn't like I can check that.
You'd see increased vaginal discharge while that happens.
It feels like a waterfall down there already.
If you see blood in the vaginal discharge or thick mucus plug that has come out because the cervix opened, then you are in real labor.
I haven't seen that.
Some women mistake early labor for severe back pains. If the pain is concentrated in the lower back versus the shoulders or upper back, it is probably labor.
Or a practice contractions.
Practice contractions may ache the one time it happens. Repeated pains in the back mean you pulled a muscle or you're in labor.
I've heard of people mistaking digestive problems for labor, fake and real.
Gas and constipation will hurt longer and put more pressure on your interior than a practice contraction, while real labor may come with pelvic pressure but the muscle contractions won't be one big squeeze.
Sure, just a big squeeze every few minutes.
Practice contractions won't come with the symptoms that make some people think they have a big stomach bug, like prolonged nausea, vomiting, and diarrhea.
If I had stomach pains and those digestive symptoms, I'd wonder if it was a stomach bug.
If you have a fever, it isn't labor. If you have stomach pains and those continue after the pooping and vomiting stop, your labor is real.
Or I have a different reason to see the doctor. Those symptoms sound serious, though.
Real labor will put heavy pressure on the internal organs, so you could have the uterine contractions and back spasms squeeze out your stomach, colon and other organs before you squeeze out the baby.
Unless there is something else going on.
Piercing pain in one place can be appendicitis or gallbladder attack, but if you have piercing pain in and around where the baby is, that can be a sign of a serious labor complication.
I know if you have heavy bleeding during labor, that's a health hazard.
Sometimes you get serious pain because something isn't detaching correctly or other complications.
So if there's any kind of serious pain, it may be labor or something else, but all of those cases are a reason to go to the hospital.
And if you're lucky, you'll have pain relievers and a pampered spa day as a push present at the end.
The cute little baby at the end is more important.